Welcome back to the Overcoming MS Living Well with Multiple Sclerosis podcast. Jeff Alex here, your host for this journey to explore the OMS 7-step recovery program. Last time we had an overview of the overall OMS approach from none other than Professor Jelinek, and it was great to hear from the founder of OMS himself. In this episode we'll be looking at some of the science behind OMS, where the research is now, and where it's likely to go in the future. Joining me for this episode is Dr. Jonthan White. Jonthan assists OMS as a medical advisor and event facilitator and works as a doctor in Northern Ireland as an obstetrician and gynaecologist with an interest in early pregnancy and recurrent miscarriage. Jonthan was diagnosed with MS in October 2015 and he's been following the OMS recovery programme ever since. Jonthan, who lives in Belfast, is married to Jenny and is a father to 18-month-old Angus. His interests include the great outdoors, reading, cycling and running, including fundraising for OMS by running 10Ks and a half marathon. Now, as someone who's run a marathon before, but this was 10 years ago, prior to my diagnosis with MS, I realised quite how difficult that is. And running a half marathon after diagnosis with MS is something that truly does inspire me as what's possible with the OMS approach. And so with that, I'd like to introduce Dr. Jonthan White. And hi, Jonthan. How are you?
Hi, Jeff. I'm very well, thank you. Thanks for inviting me along.
And so, to start off with, can we go over a bit about your background, both your sort of work background, but also OMS and MS and lifestyle and so on?
Yeah, absolutely. So I graduated as a doctor 10 years ago next week, actually. I studied at the University of Glasgow, originally from Northern Ireland, and my sort of professional working life has always been back home around the hospitals of Northern Ireland. I was in the training program as an obstetrician and gynaecologist and had my membership from the society or from the college, and had finished 5 of my 7 years of training before, 3 years ago this week actually, I had my first symptoms of MS. So I was sitting in an antenatal clinic, busy afternoon, lots and lots of patients, and I realised that my left eye was just quite sore and it felt like it was bruised or someone had hit me, or just a sort of a dull aching sensation. It was a bit sore to move, but my vision was okay, and I ignored that. I said, well, I must be tired or run down or something. I'm fine. I'll put that on the back burner. And over the course of about a week, it just didn't get any better, and my vision was very, very slightly affected, but nothing major. And I went along to the opticians and they said, oh, your contact lens needs a bit more strengthening. We'll change that for you. And I sort of went away quite happy thinking, well, that's that. But if I'm honest, I think in the back of my mind, I thought, that's not quite right. You shouldn't have a sore eye and all these sorts of things. And then 2 weeks later, I was at a friend's wedding, sitting down the shores of Strangford Lough, which is a very beautiful place. And all of a sudden, I felt like I had about 10 mobile phones buzzing in my pockets, from about my belly button down to my feet, this constant vibrating, and it was much worse when I moved my head. And I knew really straight away that was obviously not a normal thing, and I sort of pretended it wasn't there for about 24 hours before I went down to my local emergency department and said, I think I need an MRI scan. I'm pretty sure I've got MS. So I was very fortunate, probably because I was a doctor and I'd worked in the hospital, that I was able to get an MRI scan of my brain and my spinal cord very quickly. And that did show inflammatory lesions. And I then went to see a neurologist and was told, well, you've sort of got a 50-50 that it may develop into MS, and we'll scan you again in 6 weeks' time. And if we find any more spots, then that would entitle you to treatment. So I went away and had another scan, came into her office 6 weeks later, and she said, yes, there's 2 more lesions there. Rather than saying, I'm sorry to tell you, Johnny, that you have MS, I was told you have 2 more lesions, in the same way that she'd be discussing another patient with me as professionals. So that was a fairly harrowing experience, I have to say.
Yeah, it's quite difficult being a doctor. You're treated differently to, whereas it was very different for me, because obviously when you're told it's life changing, so it's sort of they cushion it somewhat. But you were told
there was no cushioning. There's no cushioning or giving a warning shot, which we're taught at medical school when you're going to break bad news. I was just told there are 2 more lesions on this scan. To which I then obviously said, so I have MS, and she went, yeah. So yeah, that's something I would hope to never do professionally, but it certainly gave me the message sunk in pretty quickly, I have to say. And at that stage, I was given my treatment options, which included, the oral medications or the infusions, and all the various information about that was given to me. And at that stage, I said, well, is there anything I can do to prevent this getting worse or to make it better? And she said, nope. I said, there's no diet, exercise, no evidence any of that is of any benefit. Go and live your life as normal, and hopefully it won't be that bad. I'm paraphrasing, but that's generally what she said. And to me, that doesn't make any sense at all. This is a disease that 70 years ago was barely even heard of. And in 70 years, your genes can't change. Genetics can't change. Evolution isn't that quick. So what has happened in 70 years to make 2.5 million people around the world have MS? And to me, it's quite simple. The answer has got to be something we're doing to ourselves. It's got to be our lifestyle, or it's got to be what we eat, or how we're behaving. And I just thought it was wrong. It's all very well to treat this disease with some very fancy medication, and I'm very grateful that is there. But at the same time, you could argue that that's almost like a elastoplast or a Band-Aid for the problem. Why not solve what's actually fundamentally causing this? And that's what led me to try and look elsewhere. And I was very, very fortunate. People have asked me before, and I can't remember if it was a Google search or Amazon, but I found Professor Jelinek, George's book, very, very quickly. And when I read that he was a doctor himself, and he'd been diagnosed a long time ago, and treatment was terrible, and he'd done all this research, put it all together, I thought, I have got to read this book. And when it arrived, I was intimidated. Even as a doctor, I was intimidated by the size of this thing and the amount of references and the studies that were quoted. But I read it from cover to cover over sort of the space of about a week, and it just made absolute sense. As a patient, as a doctor, as somebody with MS, I thought this is the right track. This has got to be the right way of doing things.
I found it really reassuring, actually, all the references, because I'd seen other things. So I was sort of slightly different the way I came to OMS, in that there were problems with my diagnosis. Crazy things. I had the consultation to discuss my lumbar puncture, ended up being the day before the lumbar puncture because it got delayed. So everything was all in the wrong order, and it ultimately took about 4 months to be fully diagnosed. And so in that period, then obviously Google is out there.
Yes, Dr. Google comes up instead. Yeah.
And you've had a lot of different things, and you find things like paleo diet and stuff, and it was things with no science really, but there's nothing backing some of these approaches up.
Yeah,
and also people interested in taking quite a lot of money off you as well.
Yes.
And so it was finding the people actually, we'll send you the book for free, and then everything in it is backed up with references and evidence, and so it's quite refreshing. And so
I think it's worth saying that as a doctor, I can understand why some neurologists in the medical community are reluctant about lifestyle intervention. I can understand that because, as you quite rightly say, there are lots of people who claim that all sorts of things are magical cures for all sorts of diseases, and the evidence quite often is not there at all to back it up. But in simple terms, the latest version of George's book has over 1,200 references, from peer-reviewed international medical journals of very high standing, and that's not the same. But unfortunately, I think superstition and tradition has really left the medical community just very skeptical about anything that they haven't done themselves, and fancy medications and treatments. And I find that personally a bit frustrating still. But I'd rather be down a coal mine with a little pickaxe, chipping away, rather than hammering at the doors of these people, because I don't think that that's necessarily going to change hearts and minds. I think we just have to continue to get better and better evidence, more and more research, an even bigger cohort of people who are recovering, who are living well, who are feeling better and better.
Yeah.
And they can't ignore us forever. They won't, because the evidence is turning, and it is becoming even more in our favor. But I think what might happen is, in 5 or 10 years' time, the medical community will proclaim this evidence and say it was theirs, and that's okay. Gary and I have often talked about it and said, well, we'll solve plastic in the oceans instead of MS. If someone else wants to take the credit, that's okay. It doesn't really matter who takes the credit, but I think it's very worthwhile noting that George was about 20 years ahead of the curve with so many aspects of this.
I think it is changing the official health service response is a bit like the when they say the MS thing, it's like turning around a oil tanker or something. It's a slow process. My neurologist is actually very positive, and he straight away said you need to be on a Mediterranean diet, and
that's brilliant. Actually, not many say that.
No, keep exercise and stress, and it wasn't. It was a lot of the OMS things, and then it turns when I subsequently discovered OMS, and then said, and I brought the book in and said, "What do you think?" And he said, so he refers to it as a Jelinek approach, and he said, "Oh no, I'm aware of Jelinek approach," and he said, he said it's not the official guidelines, so he can't, as someone in the health service, can't actually tell you anything that's not official guidelines. So he hadn't mentioned it, but basically he was sort of steering me in that direction.
Yeah, gave you the clue.
And then said, he said, well, it's not official guidelines, but he said, ultimately, if you go down that approach, there's nothing bad going to happen, because worst case scenario, you're going to reduce your risk of heart disease, of strokes, of diabetes, of cancers, and ultimately all these Western illnesses. He said, worst case scenario is you're going to miss out on eating cheese and things.
And you're not going to have a heart attack.
Yeah, it will make you healthier. There's not a downside really.
No, there's no negative side effect to it, except that, as you say, you don't get the Western diseases, which personally I'm okay with.
Yeah.
We've sort of said that at various things. Even if this were all placebo with regards to MS, well, there's huge amount of evidence now behind the whole food, plant-based way of eating with regards to cardiovascular disease. I mean, absolutely huge bodies of evidence coming out now all the time. And, big things like the recent Canadian nutritional guidelines are now advising to move towards, and this is a huge country, and this is national level guidance that we need to be moving towards whole food, plant-based eating. It's the tide is definitely turning, which is refreshing to see. But hopefully soon your neurologist, my neurologist, will be able to say, this is what you should be doing, what everybody with MS should be doing.
Yeah. So could we just talk a bit about the history of OMS?
Of course, yeah.
Where did it cover? The previous episode we spoke to George Jelinek, but we didn't really go into where all the research came from and where it's going. Yeah,
so, well, as I'm sure George told you, he was diagnosed in 1999, and he started to put together the research, I think, very quickly. As he very humbly says, it was no problem for him, although it would be a huge problem for me. He had access and he knew how to do research, and he basically trawled through the medical literature and put together the first edition of the book. But there wasn't as such, there was no Overcoming Multiple Sclerosis as a charity at that stage. Although he did start running in Melbourne and Victoria the Gawler 5-day residential retreat, which we have since replicated in the United Kingdom and actually in Europe as well, and it's still ongoing in Australia. And that was based around the initial, the 7 steps and the, I suppose, his initial research saying this is how we should be managing MS. Where the research comes from, primarily I suppose, if anybody knows anything about OMS or the Jelinek program, as people call it, it's the first thing they say is, oh, that's that funny diet. And yes, that is the cornerstone to the program. It really initially all came from a fellow called Professor Roy Swank, who was a neurologist out in North America, who I think really at the stage when he was practicing in the 50s realized that, there was no treatment for MS whatsoever. But when he himself was digging around, he found some really, really interesting literature and evidence coming out of Europe. And it went back to sort of the 30s in Switzerland, where he noticed that those in the north of Switzerland, so the north of Switzerland borders onto Germany, and they had a diet very high in butter and animal fats. They had quite high rates of MS. But those in the west, where it bordered onto France, and they had a sort of more mix. They relied heavily on dairy and fats, but They had a more Mediterranean slant to their diet as well. They had lower rates of MS. And in the south of Switzerland that borders Italy, and where they eat mainly a Mediterranean diet, they had much, much lower rates of MS. And he thought, well, there might be something into that. I'm going to look a bit further. So he did. And he found that in Norway in the 40s, there was a study that showed on a certain peninsula that those with MS who lived inland had higher relapse rates and worse disability than those that lived on the coast. And the difference was that those on the coast were eating primarily fish as their main source of protein. Fish obviously being high in vitamin D and also in omega-3 fatty acids. So that led him then to think, perhaps I could do a study myself. And really his study was absolutely phenomenal. He took 150 patients and their families, because in those days doctors were quite paternalistic, and if a doctor told you to do something, you would all do it. So 150 people with MS and all their families. And he followed them up for 34 years, which is just unbelievable. A drug trial is good if it lasts 2, 3, 4, 5 years. So this was 34 years of follow-up. And basically what he said was he wanted them to eat a diet very low in saturated fat, so under 16 grams per day. So it's not quite what George then proposed in the Jelinek diet, but the fat basis was very, very similar. And basically what happened was approximately half the group, so it's 75, followed a very low fat diet, and 75 did not. And he followed them for the course of the 34 years. What he found was that at the end of the study, which he published in 1990 in The Lancet, which is one of the most respected journals in the world, that those following the diet closely had significantly reduced disability accumulation and disease progression. 34 years later, 95% of them in the low-fat group were still well and were still ambulant. He found that a year into the diet, there was an 80% reduction in relapses, and 5 years later, there was a 95% reduction. Absolutely huge, massive effect on MS. But unfortunately, the medical community has largely ignored what Professor Swank found, and that is very, very frustrating. And if I could just explain why I think that happened. There's the phenomenon called evidence-based medicine, but that only really came around in the 90s. So Swank was a victim of his own success because his study went on for so long. He was being judged by standards from another time. When he set up that study, there was no such thing as a randomized control trial. There was no such thing as blinding and all of the various technical things that go with it. So the criticism that's leveled at him is that they're potentially, because there was no blinding and because the doctors taking the results knew which group the patients were in, so they knew if they were in the low-fat or the high-fat group, that if you know which group the patients are in, you can record the results in a very biased way to try and skew the results that you get, if that makes sense.
Yeah.
But and that, yes, that is a valid point. As a technical point, that is correct. But the outcomes they were measuring, those doctors, were whether or not the patients were walking, wheelchair-bound, bed-bound, or dead. So it's rather difficult to fake whether or not somebody is dead, bedbound, or walking, in my view. So I think that whilst it's a valid point, is perhaps a bit arbitrary given how significant the results are. And it's been quoted as recently as 2014. People were saying the results of his 34-year study, published in The Lancet, remain the most effective treatment of multiple sclerosis ever reported. But yet, it's not. It's not mainstream treatment. I think from a heartening and positive point of view for those in the OMS community, though, there was a very, very large study that was published in January this year in Neurology, which is the very, very large, well-respected American Journal of Neurology. And they had taken 7,000 patients with MS and they divided them into 5 groups based on diet quality. So not exactly following a Swank or OMS style diet specifically, but following a diet, low in processed carbohydrates, low in dairy and sugars and processed meats and saturated fats, those sorts of things. And the people in the best, in inverted commas, the best diet group had significantly less disability and depression, they had less cognitive impairment, they had less fatigue, they had less pain. And those results were all statistically significant, which is the mark that studies are always aiming for. And as a result of that, there's an editorial written actually by a neurologist who's based in Belfast saying that anybody newly diagnosed with MS, we need to give them the healthy lifestyle message as the fundamental first thing we tell them. And that's a huge sea change, for the medical community to start to acknowledge this is, yes, it's a small step, but it's a very big step in the right direction, I certainly believe. And
so to play devil's advocate, if the research is all accurate and is sort of going back to Swank research from many years ago, we're now on to the third book by George Jelinek. Sort of, he had one book, then he had the first OMS book, and then we're in the second edition of that. Yeah. So why is the sort of new books coming out with updates to them?
Well, so actually, when you look at from the very first book to the latest edition, the actual recommendations of the 7-step, there's only one thing that has changed, and that is that instead of, we used to say that you should probably use fish oil in the first year to 2 years of the program and then switch to flaxseed oil as your primary supplemental source of omega-3. And the only thing that's different now is that we say right from the start, you should just use flaxseed oil, 20 to 40 mils a day. Everything else has remained the same. The diet is whole food, plant-based, plus or minus seafood if you desire. That is absolutely unchanged, as is the vitamin D, medication if you need it. And that, I think that is where the biggest update, if you like, in the book is that the medication is evolving so rapidly. And when the books were first, when George wrote the first book, there really only were two options, which were the interferons or Copaxone, neither of which were hugely effective and came with, particularly with interferons, came with a fairly significant side effect profile. And I think George would admit himself that he wasn't hugely swayed by the medication argument. It wasn't particularly pro-medication. So the focus really wasn't so much on that. And I think the medical community distrusted OMS because of that. It was felt that it was either medication or this crazy lifestyle idea. But with the latest edition of the book, there's a much greater emphasis on the research behind medication, the new treatments that are coming out, the areas of research that are ongoing, and I think sort of a more balanced approach towards it. So I think it's not that anything has been shown to be wrong, but it's a question of keeping up to date and showing the research that is ongoing. But just to explain slightly about the flaxseed oil itself, that came from George's own work in the University of Melbourne at the Neuroepidemiology Unit, or the NEU, where they have this study called the Holism Study, 2,517 people in 57 countries around the world with MS, and it's the only independent database. So it's not collected by a drug company with a vested interest in the medication. It's an independent database of health outcomes and lifestyle interventions. And they found, when they were analysing the data, that there was an approximately 60% relapse rate reduction with flaxseed oil supplementation, but not that there wasn't a significant decrease if it was using fish oil. So that's why that changed. So that's completely right. That as a doctor, that's very reassuring and heartening that we're finding evidence changes. Evidence is always moving forward, and as a result, the program adjusted. And that I think to all OMSers should be a very positive step, that we are always analysing, and George and his team are always moving forward with the research. And as the evidence changes, so too is the program. But the program, very hearteningly, has not had to change.
So it's just minor.
Yeah, it's tweaking. It's tweaking, and it's information. The book is a phenomenal piece of work and a textbook more than anything else. So yes, it's only right that George, striving for perfection and completeness, wants to show these are the new treatments that are coming. These are the new areas of research and a potential way forward for the future. But no, the program itself is rock solid, and the evidence that's coming now from sources outside of OMS is increasingly backing it up, which is very reassuring to see.
And is there what's sort of latest updates to it? Is there any changes that have happened in the last year or two?
To the program, or
certainly since the latest edition of the book came out.
No, so at the minute there's none. Well, I hope there are none, because I'm not teaching anything different.
Well, I saw there was something on the OMS website about vitamin K2.
Yeah, that's a really good point. So you'll see that every so often on the OMS website, when research comes out, one of us will write a blog sort of putting it together and explaining it. So vitamin K2 is a really interesting point. I would say that at the minute, we haven't added it into the program because the evidence for its benefit isn't quite there. But basically, vitamin K2 is another one of the fat-soluble vitamins, like vitamin D, or vitamin D as we call it here. And in Australia they always call it vitamin. But vitamin K2 has been shown to be lower in the blood of people with MS. And it has a role with, works alongside vitamin D and control of calcium levels in the bloodstream. And at the minute, no one's done the research that says taking vitamin K2 has a positive effect on MS. All we've seen at the minute is that there's a link between the two. So it's a sort of, at this stage, it's a watch this space rather than...
So we don't know if it's a cause or effect.
Absolutely. It's the chicken and the egg argument at the minute. And until the research shows that there's benefit from taking K2, we don't advise it. And that really goes for lots of supplements. The only supplements that we advocate using are obviously flaxseed oil, vitamin D, and if you don't eat fish and you're purely vegan in your eating, then vitamin B12, because vitamin B12 comes from fish and animal sources. So those are the only supplements, because all of those things have been shown to be of benefit, whereas there are lots of other things that are quoted, magnesium and selenium and zinc and all sorts of minerals and supplements.
Yeah, but there's absolutely loads. I mean, it does come up in the forums sometimes on the OMS site. Biotin is another one. That specifically is quite an interesting one, because there was research. There were applications for a trial into very, very high dose biotin, like 7,000 times the recommended daily intake of biotin, and which is one of the B vitamins. And actually, after the license was granted and they started the trial, the company itself pulled a halt to it. They said the results so far are not bearing out, and we're pulling back. So that trial has sort of ground to a halt at the minute. So yes, there are lots of supplements that people mention and say, oh, this is the latest thing, and some of them may have some benefit in those small studies, but it's to do with the quality of the evidence. If you type in MS and supplements into Google, you'll get, and it would just be overwhelming, and you physically can't. If you take 40 supplements and you see benefit from, how do you know which of those supplements is doing you good? It's not an area that it makes things overly complicated until the supplements specifically are shown to be of specific benefit in MS. Then I think it's quite right that we sort of hold judgment and say, let's wait and see how things come out. And that's just good. Is good medical practice. That's exactly what your neurologist is doing. Unfortunately, they're saying it about us, but that is what we should be doing. We should be cautious, and we should stand back and wait till there is really good quality evidence that says this is beneficial, and then absolutely, I believe the program should and would change. There was another OMS who actually used the phrase to me when I was very early in the protocol at a local meeting, and he said he used the phrase "chasing rainbows." He said some people are chasing rainbows. Yeah. Basically, just thinking there is one tablet or supplement they could be taking, and that would be the cure. Yeah, and they were just trying every different thing.
Unfortunately, at the minute there is not. There's no. We should always be chasing a rainbow. We should always be aiming for a cure. But no, unfortunately, I haven't seen anything that says that there's one supplement that is that pot of gold at the end of the rainbow, I'm afraid.
So do you think that there's likely to be changes to the OMS protocol, or sort of largely it would just be the sort of finessing
there will definitely be fine tuning, but I think there's a couple of things that I'm not speaking specifically for George, but there's two aspects that I think probably may come into the program. One would be with regards to fasting and intermittent fasting. That's a really fascinating area of research, and it's been shown. It was really in mice models, but it's now starting to be tested in humans, that this intermittent fasting, so you may have heard of this, sort of the 5-2 diet that became very fast years ago, and it's a sort of modified version of intermittent fasting where there are lots of different protocols, but essentially it involves really severe calorie restrictions, so down to maybe 400, 500 calories a day for set periods of time, and sometimes it's for a few days within a cycle of every 6 weeks or something, and I don't have the specifics, but the evidence so far is very impressive with regards to the effect it has on the immune system, the immune chemistry. We're always talking about the balance between pro and anti-inflammatory. And in MS, there's a very pro-inflammatory balance to that seesaw, that what we call the Th1 response tends to be in overdrive. And certainly the research so far with regards to intermittent fasting shows that it can have a massive effect on those immune chemicals that light up the inflammatory cascade. So you can turn that side off, and instead you get then the sort of the rest and repair, or what we call the Th2 immune response instead. And that's absolutely fascinating. And that is a huge area of research, and that's definitely going to be something to watch over the next few years. The other thing that I think is really, really interesting is to do with the gut microbiome and to do with probiotic therapies. There's, again, some evidence coming out, study in Iran recently that showed whilst you're taking the probiotic, so when you stop it, the benefit also stops, but while you're taking it, there's a sort of a switch off of the pro-inflammatory and a turning on of the anti-inflammatory immune cascade again. And there's a huge amount of research going on into sort of gut health and the connection between the gut and the brain. And, we know that there are more bacteria in your gut than there are cells in your body. I mean, trillions and trillions of bacteria. And those with inflammatory conditions, including MS, tend to have an imbalance or an overgrowth of the pro-inflammatory bacteria rather than the sort of anti-inflammatory. And that's got to be to do with your lifestyle and your diet. And, you can show that by changing the way you eat or by supplementing with the good bacteria, that then in turn alters the immune chemistry. So those two things, I think, fasting and sort of probiotics and generally gut health, are two really very interesting areas of MS research, and that's something certainly that OMS are definitely watching, and there's so many queries come in about that all the time. But again, there's the sort of the word of caution is that we're in the early stages of that research, and it's not 100% proven, and there's not going to be large scale trials.
So if you were just thinking, okay, what else could I do to help myself? Then something like I take a probiotic tablets, and because in my mind, I think, well, okay, what's the pros and cons? I think, well, these things aren't going to do me any harm.
Absolutely not.
And they might do me some good.
Absolutely
so is that the sort of approach that you'd use for things? I mean, I know what you're saying about biotin. I don't want to be taking 7,000 times the amount of typical biotin. That might do me some harm, but...
Yeah, no, absolutely. So, yes, taking a probiotic has lots of benefits, and lots of people take them. So, no, it's not going to do any harm. But, again, you have to sort of say, is this categorically going to do me good? With my OMS hat on, if we're going to add things into the 7-step program, you have to be fairly cautious about what you open the gates to. And so I have absolutely no problem. I take a probiotic, especially if you have a course of antibiotics. I would always take a probiotic because your good bacteria are going to be wiped out as the antibiotic treats your infections. So I have no problem taking a probiotic. But we can't specifically include it in the program until the evidence says it's there. And I think that's good medical science, and that's the way it should be done. But yeah, absolutely. If you want to take a probiotic, it's certainly not a bad thing.
Okay. With that, we've been talking for about half an hour now, so I'd like to thank you very much for giving us some understanding of OMS and how things are changing. And I know that you're doing one of the retreats as well in the autumn or fall, depending where you are in the world.
Yes.
And so yeah, very much looking forward to hearing more from you then. And just like to say thank you very much, Dr. Jonthan White.
Thank you very much, Jeff. Thanks for having me. Thank you.
Thanks for joining us, and I hope you got some more useful information about OMS. Don't forget there's a wealth of information at overcomingms.org. Once again, that's overcomingms.org, with recipes, exercise tips, the ability to connect with other OMSers on the forum and in your local area via our OMS Circles programme. The website is a great place to learn about the latest research going on in the MS world generally and related to OMS specifically. I'd encourage you to register on the site and stay informed about the latest news and updates. Diet is not the only aspect of OMS, but it's certainly a major component, and so in our next episode we'll be discussing the OMS diet. We'll have some information about the guidelines for the OMS diet, cooking tips, eating out while following the OMS protocol, and I'd encourage you to subscribe to this podcast to keep up to date with the episodes, and please feel free to share the podcast with others who might find it useful. Thanks again for listening and for joining me on this journey to overcoming MS and living well with multiple sclerosis. I'm Jeff Alex, and I'll catch up with you again on the next episode.